Right. Happy St. Patrick's Day. Called to order this meeting on March 17th of the Public Safety, Finance, and Strategic Support Committee. If we can do a roll call, please.
Arenas? Jones?
Present.
Mahan? Jimenez?
Present.
Perales?
Here.
We have a quorum.
All right, thank you. And before we get into the bulk of the items, I do want to remind our committee members and members of the public to follow our code of conduct at the meetings. This includes commenting on the specific agenda item only and addressing the full body. Public speakers will not engage in a conversation with the chair or council members, and all members of this committee and staff and the public are expected to refrain from abusive language. Repeated failure to comply with the code of conduct, which will disrupt, disturb, or impede on the orderly conduct of the meeting, may result in removal from the meeting. The meeting of the Public Safety, Finance, and Strategic Support Committee now will begin. We'll start with item review of our work plan. Do believe we have one item being recommended for deferral. And if we can, well, first I'll open it up to actually members of the community, unless staff wanted to present on that, but I think it's stated in there. Please.
Yeah, no presentation of the council member.
Okay, we'll go to members of the public. Don't see anybody with their hand up, so we'll bring it back to members of the committee, and I'll ask for a motion to accept the work plan.
So moved. Jones.
Second.
Great, thank you. And I see no hands raised, so can we get a roll call vote, please?
Jones?
Aye.
Mahan?
Aye.
Jimenez?
Aye.
Perales?
Yes.
Thank you.
And we have nothing on consent, so that gets us right down into item D1, which will be our gender-based violence response and strategy annual report.
Thank you, Chair Perales. We'll start off. I think, Mike, you're going to populate. Thank you, sir. So, as many of you know already, I have moved out of SAU and Internal Affairs. Your new sergeant lieutenant is Ken Tran. He's here with us today. We'll introduce him shortly. We also have a new captain, Captain Jason Dwyer, and he's also present in this meeting. Our third panelist is going to be YWCA Director of Support Services, Lindsay Mansfield, and she's here. Hi, Lindsay. Unfortunately, Angeli will not be with us today. She's out getting married, so congratulations to Angeli. And before I start off, I just want to thank a few people. I want to thank City Manager Jennifer McGuire for her continual support. I also want to thank Assistant City Manager Lee Wilcox for the support he's given us. Also, Mayor Sam Liccardo, Vice Mayor Chappie Jones, Chair Perales, Councilmember Rennis, and all former and current members of PISFIS. Also want to thank Peter Hamilton, who's been extremely instrumental in the coordination between the City Manager's Office and the San Jose Police Department. And locally, I'm grateful for Chief Mata, Deputy Chief Washburn, and my captain, who's also moved on, Captain Randy Schriefer. You've all made my time in SAU very enjoyable. Said it before, I'll say it again, YWCA, I want to thank you, Lindsay, and your partners. Other partners I want to thank is DA's office, Suda One Tran and her team, James Dewan Shapiro and all the staff at the CAC, Dr. Stern, Mary Ritter, and all the medical professionals who assist survivors of sexual assault, and Erica Elliott and all of our friends at Community Solutions. And last but not least, I want to thank the 5 sergeants, 20 detectives, and 5 professional staff who put our stated vision into practice. And for that, I'm very grateful. And that will get us to the next slide, please, Mr.
I'll interject for a moment, but thank you very much, Lieutenant Jimenez, for your work, and I think tremendous progress that you've been able to help us make here, and look forward to your next endeavor in challenging assignment, but very, very excited for your growth within the department as well, and thank you, and look forward to working with the new team here.
I appreciate that. Thanks, Mike. And then this is just an overview of the 5 areas that we'll target, update on sexual assault work items, sexual assault crime statistics and trends, the COVID-19 impact, SAU specific reporting, and talk a little bit briefly about some challenges and some recommendations. So if you don't mind, next slide, please. And we're going to begin with the update on the sexual assault work items. Next slide. So on this slide, you're going to see 8 out of the 13 San Jose work items have been completed. I'm going to talk briefly about the ones that are in process. Item 1B, evaluate and reformat department resource cards. This is in its final stages, reviewing the translations in Vietnamese and Spanish, just getting those done, and these should be online soon. Item 2G, trauma-informed care training for all officers. This is about 85% complete with 846 personnel trained in the department. Item 2H, a substandard housing study. This will be going out shortly back out to RFP once it's finalized. So there's been some adjustments made, and they're going to go out to RFP here shortly again. And if you don't mind, next slide, please. All right, we're continuing on with some work items. And number 4 here, strangulation evidence collection. This is funded countywide and is employed by the SAFE team who collect evidence and write reports for police investigations. Number 5, explore cost and funding of 2 child forensic interviewers to the CAC. The district attorney's office recently added additional funding, increasing our budget in this area from $72,000 to $237,000 approximately. We have also submitted here locally a budget proposal asking for additional funding from the city, and we're working with the district attorney's office to hire more child forensic interviewers currently. And at this point, I'm going to pass the presentation over to Lieutenant Ken Tran, who's going to talk about slides 6 through 15.
Thank you, Lieutenant Jimenez. Good afternoon. I will go over sexual assault crime statistics and trends. Next slide, please. So this is a count of sexual assault related primary offenses from January 1st of 2016 to December 31st, 2021. This is a breakdown of the 9,087 primary offenses reported by the various types of sex-related primary offenses listed. We see that Penal Code 288A remains one of the most reported crimes, and rape appeared to be on the rise. Overall, there was a 21.4% increase in sex offense from 2016 to 2021. Next slide, please. So on this slide, we have the heat map of the primary offense count with child molest as the only category. As we look at the map, we can see more incidents are reported during the school year than the summer and winter break months. Table 2A below shows the time between occurrence and report date. We can see that more incidents of child molest are reported 11 days or more after the incident occurred. Next slide, please. So this is the heat map. I'm sorry, can we go back to the previous slide, please? This is the heat map with rape as the only category. However, there are 8 offenses categorized as rape, including spousal rape. We can see that on average, more incidents are reported during the months of July to October. Table 3A shows the time between occurrence and report date. Please note more incidents, or approximately 63%, are reported within 10 days or less after the incident occurred. Next slide, please. Table 4A is the count and heat map of the age of survivors and at the time of report for juvenile and adult. If you notice, survivors aged from 12 to 17 continue to be overrepresented. SAU is continuing to work with our crime prevention unit to provide training to increase reporting and to raise awareness in the impacted communities. This is done by providing timely data so crime prevention specialists can provide presentations in local schools, place of worship, businesses, and community forums in the languages preferred by the audience. Next slide, please. This slide is the heat map showing geographical areas impacted by pediatric, adolescent, and adult sexual assault. What's shown is the top 20 zip codes. Please note some of the top zip codes like 95112, 95116, and 95122. Next slide, please. So on this slide, we have the heat map of the top 20 zip codes again, but for juvenile and adult arrestees. We see some of the zip codes that were at the top of, that are on the top of this slide were also present at the previous slide for juvenile and adult survivors. Next slide, please. So here we have heat maps for the total count and percentage breakdown by ethnicity as identified by survivors for juvenile and adult survivors. Table 6A addresses juvenile survivors by ethnicity, and Table 6B addresses adult survivors by ethnicity. We see that the AAPI community seems underrepresented in the count based on the census majority in the city. So 9.4% for juvenile and juvenile survivors and 12.9% for adult survivors. We are developing plans to collaborate with our crime prevention unit and our partners like the YWCA and the DA's office to increase reporting from our AAPI community through education to raise awareness. Next slide, please. Next slide, please. So table 8A on this slide is also a count of cases reported from 2016 to 2021. The monthly breakdown illustrates the fluctuation in the number of cases over the COVID-19 pandemic. As you can see, cases show a sharp decline in the calendar year of 2020 when shelter-in-place orders were in place. However, case numbers rebounded the following year, 2021, when COVID-19 restrictions were lifted. So at this point, I will turn our presentation back to Lieutenant Jimenez. Thank you.
Yeah, if you don't mind, Mike, can you get me to the next slide? So we'll talk a little bit about the count of SAU internal case status. Over the last year, 2 years, SAU has made several changes to internal policies to provide excellent service to survivors of sexual assault. This chart highlights the following two areas. One, cases submitted to the District Attorney's Office for review went from 39.3% in 2016 to 57.7% in 2021. Essentially what we're doing is we're submitting more cases to the District Attorney's Office. The second highlight here is that cases closed due to lack of investigative leads went from 35.7% in calendar year 2016 or year 2016 to 0 in 2021. And that was partially through PISFIS, right? We did the K King study and we got that down to where we wanted it to be, down to 0. All in all, SAU closed 96.8% of its cases under the 3 categories: DA submissions, all leads exhausted, and transferred to another agency. And this is consistent with the intent of the policy changes we enacted. Next slide, please. So this slide shows similar trends as the previous slide due to the changes in internal policy, which is to refer more cases to the DA's office and eliminate closing cases administratively. Next slide, please. I'm sorry if I went real fast on that one. This slide's exciting. This talks about grant awards. The department applied for and received 2 grants totaling approximately $1.5 million to test the backlog of untested safe kits. The grant awards will be coming to council for approval soon. If not, I think one may have happened already. The department, assuming the grants get approved, will be testing its entire backlog of untested SART kits, which far exceeds the legislative mandate. And currently, SAU is working with the fiscal unit and the crime lab to ensure all necessary contracts are in place to make this happen. Next slide, please. This slide shows how members of SAU and the pediatric medical team collaborated to better serve pediatric and adolescent survivors of sexual assault. The 2 teams agreed that all children interviewed at the CAC would be referred to the pediatric medical team, regardless of whether or not the case was approved. This program is viewed as a success by both teams and ultimately resulted in a 10% increase in approvals by the police during this time frame. So this is definitely a success. Next slide, please. At this time, I'm going to pass this over to Lindsay to talk about YWCA.
Thanks, Simon, and thanks everyone for allowing us to be here. So a couple of things I just wanted to say is that the relationship between San Jose Police Department and YWCA just continues to grow. Our relationships are deepening, and that's really led to some incredible improvements. I think that we have a more survivor-centered process overall. Rights and options are being clearly communicated to survivors a lot more consistently. There's better communication between YWCA and law enforcement, and a better understanding of like all of our roles and our procedures. So all of that also leads to a huge connection between advocates and survivors that we really didn't have in the past. So those are all really positive aspects, obviously. What I can say from YWCA's perspective is we could not have anticipated a 576% increase in the referrals that would come in. This leads to wait lists and increased caseloads for all of the providers, all of the staff that are doing these services. The Family Violence Unit currently has an embedded advocate through San Jose city funding, and the SAIU advocate that was in place was actually through a federal grant, which has not been renewed. So in order for us to continue to meet the needs of survivors, ideally, we would really have 2 embedded advocates at Family Violence Unit, 2 embedded advocates at Sexual Assault Investigative Unit. But really, what I'd like to respectfully request is that the city make a decision to match what they're doing for the Family Violence Unit over in SAIU, so that we do have that continued funding and equivalent resources are dedicated to both populations that we're serving. I think that's all I had to say. Thanks, Jaime.
Thanks, Lindsay. Your leadership with the YWCA has been extremely helpful. Cynthia Melchor as well, and we appreciate all Ingrid does. So it's been awesome working with you, Lindsay, and I'll still be around, I promise. So next slide, please. All right, this slide talks a little bit about duty manual revisions. Over the course of the last 2 years, SAU has updated duty manual sections due to request from this group at PISPIS and also from the auditor's team. Having that in mind, SAU decided to deep dive into all the remaining sections to better align the department with best practice and amendments to the California Penal Code over the years. The 3 new sections that are highlighted in this slide address the following. 1, mandatory reporting of sexual assault. You can see on the right-hand side there. 2, notification of sexual assault bill of rights. And 3, notification of right to have a survivor advocate and peer support person present during investigative interviews. And all in all, every duty manual section related to sexual assault was reviewed and amended as needed by the Sexual Assault Investigation Unit. Next slide. On March 11, 2021, the Office of the City Auditor completed an audit regarding how the SJP provides advocacy. The audit targeted not only SAU, but SVU and the Family Violence Unit. 6 recommendations were provided, and all 6 have been completed or are very close to completion. This is a testament to how serious the department takes survivor advocacy and its willingness to quickly resolve any gaps related to advocacy. Next slide, please. We're going to talk a little bit about the challenges and moving forward. I'll talk about challenges, and then Lieutenant Tran will talk about moving forward because he will be part of that process, and I no longer will, unfortunately. But next slide, please. The 3 main challenges that the SAU experiences are the following. Lindsay spoke about this, but we did not receive the Office of Violence Against Women grant, which is set to expire at the end of summer. This grant has provided funding for the YWCA in-house advocate. Budget proposal has been submitted requesting ongoing funding for the in-house advocate in SAU. 2, the 3 lieutenants in SAU, SVU, and Family Violence Unit all rely heavily on 1 analyst. That's CIA Angeli Montesa, who we appreciate tremendously. Although Angeli does great work, more capacity would help to provide data to inform our decision-making process. Recently, the SVU lieutenant submitted a budget proposal requesting an analyst be assigned to SVU to help with to build capacity. The third thing that we would like to talk about is not having the capacity in the crime prevention unit to support SAU, SVU, and Family Violence Unit has been difficult. Crime prevention specialists greatly assist the department in targeted prevention and intervention efforts. And Lieutenant Tran spoke about that previously. And for the next slide, I'll pass it back to Lieutenant Tran.
Thank you, Jaime. So moving forward, the SAU will continue to partner with crime prevention unit specialists to provide prevention and intervention services to communities experiencing higher levels of abuse. SAU personnel will work more closely with our ethnic-based agencies with an emphasis on Asian service providers to ensure that we have a more equitable approach to education intervention in those communities. And that's all I have. Thank you. And next slide, please.
Thank you very much, Lieutenant Tran, and welcome. We will go to members of the public first. And as a reminder here, we are speaking on item D1, which is the Gender-Based Violence Response and Strategy Annual Report. And you will have 2 minutes on this item. First up is Jill Borders.
Hi, thank you. Thank you for this report. I just wanted to make one comment, if I might. In looking over all of those numbers, I've done this prior actually too, and looking over all those numbers, I just want to point out that we spend a lot of time talking about our Vision Zero program and how our fatalities and accidents and injuries on our roads are something that of extreme importance, of course, which they are. But I hope you will be mindful that these numbers are horrific in the category of rape. And it is troubling to me. We spend a lot of time discussing Vision Zero, and it would be wonderful to have a city where the idea of a Vision Zero where no one experiences rape would be an ideal conversation to have. Thank you.
Thank you, Jill. And next up will be Blair Beekman.
Hi, Blair Beekman here. Thanks a lot for your meeting today. I wanted to try to offer, hopefully I've grown a bit and you've been trying to talk about domestic violence issues for in many council sessions and committee meetings, and it's nice that you do that. It makes something clear what we should be working for as a city. And so I know you guys do try. And why I think, for instance, the gun ordinance things that came around were easy for me to understand. They're just always on the agenda to talk about how to address domestic violence issues and counseling services and better practices for ourselves. Thank you for all these efforts over the years. And I just wanted to quickly offer, I've been learning, from the Reimagine Public Safety Task Force Committee. They're doing their own work in these efforts. The ideas of the peer review program for police is still not fully in swing yet. But I know we think about it, and I hope it can still be an option for San Jose, that I think counseling services between police officers and talking to themselves after they take down these cases and fill out reports and stuff, for them to have counseling sessions and therapy understandings, with the logic of we speak of this stuff today, I think can really help the whole process, the whole community process overall, and help a lot of overall goals we're trying to build for the future of community and reimagine in San Jose, where police can feel safer to talk about issues that they currently feel a bit too uncomfortable to talk about. So good luck with these efforts. Thank you for your patience and my reminders.
Thank you. That'll conclude our public comment. I'll come back to members of the committee and go to Councilmember Arenas.
Thank you, Chair. And it's wonderful to see you one last time, Lieutenant Jimenez. I wish you well in your next endeavor. We probably will see you once again, and I'll call you Captain. Oh, Captain, accurately. So for the time being, Lieutenant Jimenez, I just want to thank you for the work that you've done. And since you first started, I've been very impressed by the level of detail that you have to your work. And so I just wanted to thank you for that, and just the passion that you have around serving our young survivors in our city, and making sure that you get to some systemic changes that I think we both have in common. And so I really appreciate that. Thank you. Moving on to the report that we have in front of us, and welcome, Lieutenant Ken Tran. I look forward to working with you. As I was looking through the report, I think that we have to take a look at the work that we've done, and appreciate that we are changing systems, and that systems move slowly. And some of the benefits of those improvements, we'll see them with time, right? I think for now we can see some very immediate results, like the strangulation pilot that was, it's very apparent, the response from that pilot program. When I look at the impact that we've, or not that we can prevent any of these, unfortunately, any of these crimes, but when we provide some prevention and intervention, we can hold off maybe and create some awareness for our community. I continue to be very concerned that even though there was a shelter in place, and even though we had a pandemic that forced people to be in their homes, and not have access, and a lot of children not have access to somebody outside of their home who they could confide in and share some of the abuse with, we had a very similar number of survivors, as if we were in a regular year. And that to me is absolutely horrendous. And we do have to take additional measures. And I really appreciate the comment from Jill Borders, who just finished speaking. We have to make sure that that we interrupt this pipeline. And this is the pipeline that is similar to the prison, school to prison pipeline that we've created a whole division for, which is the Mayor's Gang Task Force. And we have grantees that provide that intervention and that support for those communities. And yet there's this other pipeline around sexual abuse, especially for our very young survivors, and we have minimal. And we're relying on outside grants for embedded advocates. And so this is where I'm glad that you're letting us know, Lindsay, about those challenges, and Lieutenant Jimenez. This is where, we talk to our city manager and ask for some of those changes, because if we don't have the kinds of responses within our own systems, we're just going to continue to review this year after year, be astonished about the results, feel better about the way that we're working with one another, and maybe closing some of those cases and working better with the DA. But in the end, these crimes are going to continue to happen. And unless there is a real response in terms of programming that is directly a result of the work that we're doing here, I just see us having this cycle of conversation over the remaining years that I have in my term. And so this is, Lee, where I'm going to look at you in the city manager's office. I know that you're going to consider this this budget ask that our staff is asking, and I think it's very modest. I think it's at the minimum that we can actually do. But I'm going to go over that, and I'm going to ask for us to really take a look at a real response to sexual assault, Lee. I don't know how much more we can improve our systems, and certainly we can. This could be an endless battle with our systems. And say we get to a really great place where our officers are trained, where we have these advocates embedded, where we provide what we need to with our Bill of Rights and the cards and the kinds of strategies that engage in a meaningful manner and a supportive manner that are trauma informed with our officers and the children that are survivors. And that we have this great relationship with our Children's Advocacy Center. And yet, and we're near that, maybe that's that place, yet what else are we doing for these survivors that we can provide some level of accountability? And so, you know, I know this goes beyond what this committee deals with, but I'm going to look for you. I'm going to propose something in our budget that addresses this in a very meaningful way. Now, we've been getting scraps off the table for the last 3 years. And we've been doing, I think, our San Jose Police Department and the investigative units that are related to these issues have been doing a stellar job, just making miracles with very little and with what they have and the passion that is in their hearts. But we need more than that. We need intervention and responsive programming that can address the issues that we have at hand so we can actually interrupt this pipeline. So Lee, we need an offline meeting about this, and I'm going to request this from you. But in the meantime, I'm going to ask about the work that we talked about last time in our joint meetings, where the superintendent came in and you know, she was very concerned, and this was from Alum Rock School District, because there was going to be an inflow of child abuse cases, and she wanted to make sure that there was a good connection with our San Jose Police Department. Did our superintendent, was she connected to that smaller advisory group, Lieutenant Jimenez, that's connected with the Children's Advocacy Center?
Yeah, great question, Councilmember Renz. Thank you for asking it. I'll be honest with you, I was involved in some emails with James Given Shapiro asking to get the meetings going, because eventually it was supposed to be housed at the CAC, and that's who kind of runs the CAC. I don't know where it actually got to. I did communicate what was happening with James Given Shapiro. He did send out some emails, and I don't know if it didn't go anywhere from there. So I don't know if that advisory group was ever formed. I was never asked to be involved in it. So I unfortunately, I don't have a better answer than that. I apologize, but people were aware, and I just don't know where it's at.
I would really appreciate, Lieutenant, whether it's you or Lieutenant Tran, who does this, but we really need to have those connections in order for us to build in a greater system than ourselves that is equipped to deal with children in a very different manner than we do. You know, the school districts are getting funding for social emotional support that we don't have, and it sounds like our service provider is very much overburdened and has wait lists, and I'm really concerned about that. And so could we please follow up on that item, because I want to make sure that they have a direct relationship. You know, it's always about these relationships and having direct access to our units. And while I'm on that subject, Lindsay, what is that wait list looking like?
So we have various programs. We have counseling, which is crisis counseling. We have therapy, which is the clinical side. And then we have case management. We also have a specific LGBTQ program. So it varies depending on the program, is the reason I'm telling you, you know, all these different programs. So our therapy wait list tends to be 6 weeks or longer. Our case management wait list is around 1 month at this point in time. And then our counseling, we have about 40 people, between 20 to 40 people on that wait list at any time, and that can move it's kind of hard to say. I think the average is around 2 weeks for that crisis counseling. And I also just want to say that while we do have those wait lists, it doesn't mean that we don't have services that are offered. So if we can't do the in-depth counseling or case management, we do refer people into support groups, which we don't tend to have a wait list for, so that they can get that care. They can utilize our hotline. We also refer out to other services because we know we're not the only providers, and our goal is really just to get people connected to the support that they need. So they are served. They're just not served in the capacity and the depth that we would like for them to be.
Mm-hmm. That also concerns me, because as we know, to have immediate support is research shows that's the most beneficial. And so that's also something that I'm hoping we can talk offline, and that is part of a budget ask, and that we can augment for these units. Lee, as you are seeing, our units are doing a stellar job in improving our systems and increasing our referrals. How do we respond as an administration to this increase and the good work that they're doing? I don't want to send a message to slow down.
Yeah, thank you, Councilmember Reyes. So Lieutenant Jimenez is right. They have put in a variety of budget proposals around this and a lot of other units within the police department to kind of rebuild and make some of the momentum. So what we're doing right now is starting to put together the proposed budget around the priorities that the council approved during the March message, but also the departmental priorities. And they have raised us to the top. So we're going to be working with them. What I can promise is, obviously you'll see what we propose in the proposed budget, but along the lines of this or anything else that doesn't make it to the proposed budget, that will be articulating that in the MBA that we were directed to do around police staffing, so that you have a clear message as well around the trade-offs or what those costs are, so council has the ability to change that. But I would say what's been put in and what we've discussed, Lieutenant Jimenez and Chief Mata, is a priority of ours as well.
Yeah, and I think that's just a starting point, Lee. That is not the for me, that is not the end goal. I think they're being very modest about their ask, and I'm not going to be. And I expect this to be a very top of the shelf priority. Although I'm very supportive of foot patrol and have nothing against it, but when we talk about rape and when we talk about sexual molestation against children, there's no comparison. There just is not. So I'm going to have this as top priority, and I expect that to also be in the administration. I'm going to continue to have conversations. I'm just, when I take a look at all the really great work that our investigative units are already doing, can we push them more? Yeah, I can certainly push a little more, but they've been doing a really good job. And they've been moving the needle. And so this is when we need to come in and say, this is how we can support them in the improvements that they're already making. And so I'll also be talking to our city manager about that, because this is a point in time where we say, what else are we doing and within our systems? Okay, so I'm going to move on. And then if we could just make sure that we move all of our sexual assault response and strategy work plan mentions, if we can move that to a gender-based violence response and strategy work plan or strategy language, just to make that note, please. Okay, the next question that I have is, if only 48% of the cases of child molestation are reported within 10 days and 55% are reported 11 days or more, how does this data point impact our SAFE exams for acute within the 72 hours and non-acute medical exams?
So I'll try to answer that question. Thank you, Councilmember Renz, for the question. The San Jose Police Department stance, and it's it's not just San Jose PD, it's a best practice is 10 days, right, to approve regardless of what you have. But we obviously go beyond that, in cases where there's signs, physical signs, whether it's bruising or discharging or any type of thing that can show that there's something more going on. We extend that date beyond 10 days. However, with the program that we talked about, the pediatric medical handoff, what we've been doing is giving every single kid that we interview at the CAC over to the medical team, assuming that the family wants, right? Because, in this environment, everything's done by consent. There are some families who just don't want, to have their children go through medical examinations, and we just respect that. But we give everybody to the pediatric medical team, and they offer services. And there's going to be some exciting news surrounding this whole topic coming out that I'm not privileged to say, but Dr. Sturm will announce at some point that I think is going to make everybody here happy and shed some more positive news on how we do approvals and what that looks like in payment. So I'll leave that to other people when they're ready to talk about that. But it does impact it, right? You see the children, there are more children that go beyond 10 days before reporting, right? And delayed sexual assault in children is part of the problem, right? And our only solution that we can think of at this point is increasing intervention and prevention techniques, right? Because we can, like you say, and do all the enforcement we want, but it still happen, right? And what can we do differently? And what we need to do is use data, right? And that's why we're requesting analysts where we can use heat maps where we talk about age demographics, we talk about locations and zip codes and what type of crimes are occurring, so that we can get the education and the prevention intervention before these things occur, right? So that children can report sooner to the time that the incident occurred, so that we can approve more safes, right? That's the strategy, right? Get the children to know, what's happening so that they can report it sooner, so that we can get them, services a lot sooner, including medical intervention, right? So, and I know that's a very, it's not a very clear answer, but unfortunately, sometimes we don't work in a definitive area, right? Unfortunately, but we're definitely, it's on the map. We want to make that 100% of the kids report within a short time frame, right? That's the goal. And,
Right.
we've been moving the needle, like you said, right? Based on what happened 2 years ago to what's happening now. And you can talk to Dr. Sturm and Mary Ritter, they're impacted just by the slight changes that the San Jose Police Department makes. We overwhelm them. They're going to have to grow, right? So we also have to keep that in mind, right? So every time we make a shift, we're a large organization. It really impacts the people who support us. So we have to grow together, right? As kind of what we say. I see Lindsay nodding her head in the affirmative, but that's the reality is, we all have to grow together. And SJPD is a big organization, and we do impact people when we make decisions to do something a little bit differently. So I hope I answered your question, Council Member.
Yeah, no, you're answering the question, and I know that you can't share all of it. You're not because you don't want to be forthright, but there's something there. It sounds like, and I was going to ask about that 10% increase, but I'll leave it for another day for you to tell me, or Lieutenant Tran to tell me some part of that good news. I know that there is still going to be a conversation on the adult side as well about safe exams and the protocol and the approval. But I'm glad that you talked about that there needs to be other interventions. And this is why it's important for us to connect with those school districts, because the sooner that we connect with those school districts, typically those, teachers or those people that are confidants of our children, they're the ones that are holding some of those the key, right, to having that 72-hour response for an exam. And so for me, that's one of the reasons why I really wanted to have our school districts involved. And as you pointed out, those zip codes that are, in the red hot zones are the zip codes that we're talking about in Allen Rock School District. It's not complete because 95122 also has the Evergreen School District and also has, I think, a little portion of Franklin McKinley School District. So I think this is another avenue that we need to continue to pursue and to have these relationships with these school districts so that there isn't more bureaucracy between these two large systems. And so I look forward to that update as you tell me what is going on with Alum Rock, and maybe I'll also connect with the other school districts to make sure that they're part of that conversation. Now, moving on to the intervention piece of this, I know that you all are shifting to the prevention education that was supposed to be happening in middle schools and high schools is going to get shifted over. Is that going to go back? What is that going to turn into? I guess is my bottom line question. I'm not sure what it's turning into. What are you using that funding for?
I want to make sure that we're talking about the same thing.
It's the data-driven targeted training. They were supposed to be, they were going to be the healthy relationship trainings, but because of a pandemic, and I think because of proprietorship issues, you all couldn't conduct it online. And so there's some leftover money. I think it was 72,000. And I believe that you were all going to have some data-driven targeted trainings to the top zip codes with concentrated juvenile survivors, but I wasn't sure what those presentations were going to be.
Right, so that $72,000, once the finance team goes through it and make sure we have the money, the number may shift when everything gets paid out, but that's going to go towards crime prevention unit. If the shift's granted, we will transition that funding over to crime prevention unit at San Jose PD. Angela Lee will provide a monthly data set saying, hey, listen, in these zip codes, this age demographic, this crime are occurring, and they'll use existing programs like Choices and Consequences, C2, and different programs that they have already embedded in crime prevention unit and do more education in those areas. They're just basically using that funding to update and pursue those demographics in a much more aggressive manner to try to trend down the issues that we're seeing in those certain areas. And this would serve as a pilot for us to try to build an argument as to why we think this would be successful going forward. So we're just trying to do everything we can to prove, that if we were able to do what we're saying, that we would be successful.
I love it. I love it. I love it. You're going in the direction that I was asking for us to go through. And if it's too much, I mean, I think there's also service providers who do these trainings, and it's also, it could be, just as easy. But I love that our crime prevention would like to take that on. This is my last question, and this is about I saw the trauma-informed care training. I know that there was a really good percentage of officers already having gone through that, but we still have some ways to go. Does this also include, I know the trauma-informed doesn't necessarily include the child trauma awareness. Is this inclusive of that, or is that something separate that we should list out on the work plan?
So it's separate, and if you want, I can elaborate on what the department's done recently about the children's side of the fence. So I see you're saying yes. So I'll tell you, hey, Catherine Sims, who's our child forensic interviewer, did about an 8-minute video that was directed at the organization talking about the things that you mentioned, right? How to identify signs and symptoms of trauma in children. It's a very good video. It's been sent out department-wide as a training bulletin, and that gets dispensed via email for all the officers and all the staff to see the video. I don't know if your staff has had an opportunity to see what it looks like, or if you want to make that request, to do it through the official channels. But I think you would be very happy as to what the product is and the quality of the product. Catherine Sims is one of our professional staff. She's awesome, and she did the video, and I think it's going to satisfy, at least begin to satisfy what direction you want us to go in that specific area. So they are separate.
Good. I'd love to see the video. I'd love to see the video. Thank you so much for having that completed. I look forward to seeing it, and I look forward to continuing to work on our work plan. I know that there is a lot that has already been done. There's a great load of work that continues to need support from our administration as well as from our investigative units. So thank you so much. Welcome, Lieutenant Tran. I hope this conversation doesn't scare you off. We are all just very passionate, but we welcome you with open arms, and thank you for taking this challenge on. And like I said, good luck, Lieutenant Jimenez. I will miss you dearly. And that is it. Oh, motion to approve.
Thank you.
Second.
Right, and I don't see any other hands up from, okay, Vice Mayor Jones.
Yes, I just real quick, I want to thank the police department for all their hard work. I also agree that those numbers were horrific, and I want to just say to Councilmember Arenas that you have my full and unconditional support in terms of anything we need to do to address those numbers, because it's not acceptable. Even though I know city staff and the police department are doing everything in their power, what we can do to support you to turn those numbers around and prevent them from ever happening, we need to know what we can do and how we can support you. So that's it, Chair. Thank you.
Awesome, thank you. And Chair, if I could just for a moment say thank you so much, Vice Mayor. And I know that during my comments, I used the foot patrol as an example, and I'm not trying to, and Councilmember Peralez, I know you're very supportive of that. It came off of the top of my head. I'm not trying to compare one with the other. I just wanted to stress the importance of it. And so I just wanted to put that out there, but thank you so much, Vice Chair. Now I know that did you hear that, Lee Wilcox? Vice Mayor already said.
Whatever budget necessary. Yeah, it's I think it's certainly alarming to see these statistics, and we not new, but it doesn't make it any easier when you look at the number, especially the slide that shows the heat map. I'm just going to pull it up myself of the age range between 10 and 17, just a core focus of our young children, young adults that are going to experience something so traumatic that inevitably is going to change the complete trajectory of their lives. And it's disgusting and disheartening to look at that and know that that's happening in our community. And I think it is, I agree with actually public commenter Jill Borders on, that we have a Vision Zero goal, right, for individuals that are killed or seriously injured in traffic collisions. And that's a good goal, right? We should have that. Much like what Councilmember Dennis was just talking about, about foot patrol or other focuses that we have. What's really unfortunate is that we are under-resourced, that we're having to pit things that are all very good against one another on addressing issues in our community that all need to be addressed and are all very serious. And at the same time, that's part of the difficult decisions that we end up having to make here at the council. I think our staff will bring forward some recommendations, but ultimately, as the Vice Mayor just stated and Councilmember Arenas, then we can make some decisions on where we want to allocate some of those resources. And if we know that that we can be able to see a benefit, especially here with a reduction in sexual assaults, or obviously even just a better efficiency in being able to get the crimes reported and follow up with them and investigate them. I want to stress, though, that the other component, that crime prevention component, is so important. And Councilmember Hernandez brought up the example of the Mayor's Game Prevention Task Force. And I use this a lot when talking about, just how I feel as government agencies, nonprofits, our religious institutions, right, the court system, county, you name it, the Mayor's Game Prevention Task Force is a great model and example of all the different sectors and traditional silos that would be interested in particular topics working together. The Vision Zero Task Force is trying to do something similar, right? Pulling people together. And we don't do that with everything. Councilmember Arenas has actually done a good job at getting the county and the city to work better together in this regard, and in regards to issues with sexual assault and domestic violence, intimate partner violence, and I think we honestly need to do more of that, right? Where we are looking at this and partnering better, because it's not going to be our city staff or our police department or even crime prevention, right? That's going to be able to accomplish everything. Not even our nonprofit partners that we are tied at the hip with here when it comes to Next Door Solutions, YWCA, groups that we work with very closely, that we also know are not going to have all the resources to address everything when it comes to that especially that prevention piece of it. And I think that's extremely important, because if we only focus on responding to the crimes, then we're essentially accepting the fact that they're going to always happen, right? And we need to have a part. That doesn't mean, again, that shifts the role of the police officers or the detectives, because they have a very important role. But that does mean that we play a part in that crime prevention, which we're I think proud to have a crime prevention unit. But again, they're going out there taking on a very small team, taking on a myriad of issues across our community. They can't do it all either. And so where we can best allocate our resources within our police department and our city staff, I think, we want to make sure that we can do that. But then we also need to be able to hear more from our nonprofit and community partners, like we are hearing today, right? And I think we need to be able to do that more often. And I do like the examples that Councilor Arenas has set over the last couple of years with some joint hearings, because I do think that has helped to move the needle when it comes to some of the efforts that we've been working on. And I think that we could go even a step further. And when it comes to issues that we want to raise to the level of crises, we could pull together even more stakeholders that can play a part. And certainly, I think that's what it's going to take. And I would love to see these numbers trend down and continue to trend down year over year versus what we see, which is a bit of a roller coaster, and really what looks like very little progress in essence, right, being made, because you kind of see high numbers year over year, and that's certainly challenging to be able to know. And I'm just fortunate that, right, within my own personal family, I haven't experienced that kind of trauma, and right, or nobody in my immediate family. Can't imagine what that would be like, and I know that that's what drives the passion of a lot of individuals in our community to really want to help us in this regard and help us be successful in it. And I think that's what that emphasis of Councilor Arenas on that, right, that trauma-informed training, right, really understanding that this isn't just about doing a job, right? It's not just about taking some notes or responding to a call or going through the motions, that there's a lot of trauma involved with this. And that if you have a better understanding of that, you can then likely do a much better job, right, at just the basics of the job itself. Let's see here. I don't think I had any other questions on the slides or the reports, but appreciate the input and the continued and consistent advocacy from Councilman Arenas, and look forward to continue to work ahead. And again, welcome Lieutenant Tran and Captain Dwyer, and then wishing you well, Lieutenant Jimenez. Okay, we'll do a roll call vote, please.
Arenas,
Yes.
Jones,
Aye.
Mahan,
Aye.
Jimenez,
Aye.
Perales.
Yes.
Thank you.
Okay, motion passes unanimously. Thank you very much. That'll move us on to item D2, which is our fire department call volume status report.
Hello, just give me a moment to share the screen. Okay, hopefully everyone can see the screen. Okay.
Yes.
All right, thank you for your time, Chairperson Prowse. My name is John Healy. I'm the Deputy Fire Chief in charge of operations, and I'm here to present the Fire Department call volume status report for fiscal year 2021. So the first slide in front of you shows the fiscal year of the past 5 fiscal years from 2016 through 2021. The blue reflects the city's population and the orange line reflects the fire department's call volume. So as the population had a slight increase in 2017, our call volume went up with it, and then a slight decrease in 2018-19. Then over the past 2 years, again, we've had a significant call increase that has gone above the population, actually declining a little bit in 2019 and starting to rebound again in 2021. So the slides basically reflect that as the population in those 5 years has decreased 3.1%, our fire department call volume has actually increased 4.3% to this past year being 94,784 calls. The next chart on your thing, our fire department is divided into 5 areas, the 5 battalions that cover the central, east, north, west, and south ends of the city, as you can see with the 5 battalions. And that second chart shows the call volumes in those areas. And as you can see, Battalion 1, the center of the city, is the highest call volume with almost 25,000 calls. Chart 3 below that further breaks down that information into each station within those 5 battalions. As you can see, with Fire Station 26 being our busiest engine company with just over 6,100 response areas during that past year. Again, with the soon to be opening Station 37, that will help reduce the call volume to District 26 and some of the other surrounding stations when Station 37 officially opens here shortly, and will help blend that response data out further and improve our response times. Chart 4 is a heat map with the locations of our fire stations included on it. The blue color reflects the areas with the lowest call volume, while the red reflects the areas with the highest call volume. And as you can see, the center of the city where Battalion 1 is located has the highest number of requests for service for incidents. Heat map number, chart 5's heat map reflects the response travel times greater than 4 minutes, ranging from green being the lowest to area to the orange showing the highest response time areas. And again, it's in the downtown where the highest call request for services is. So sometimes the closest apparatus is not necessarily the one serving the area because they're already on an incident. So another one comes, and that also leads to additional response times. Chart 6 is distribution of the different types of incidents we respond on, with the orange color being the medical emergencies, and that represents 60% of the responses that the fire department responds on. The blue area, it reflects our fire responses, which is 5%. And also it shows the calls for service that are shown in a light orange color or more of a yellow color. Those represent 10% of the calls, and those are more of your requests for services or good intent calls. And the dark blue is just other calls unclassified. They could be police assist calls or other types of calls like that that we respond on to assist throughout the city. The EMS call volume over the 5 fiscal years is shown in chart 7, and it's a breakdown of the medical calls compared to all other responses. So over the 5 years, the trend that this presents is that our EMS calls have risen about 2% over that 5-year period, while all our other calls have rose about 8%. As you can see that, so in 2021, of the 94,000 calls, the 57,000 that were EMS and the 37,000 plus that were the other calls combined in, including our fire calls. Okay, chart 8 is the county EMS, or excuse me, chart 8 is our patient age distribution, and it shows the age of our patients, with the majority of our patients being of age 50 or over. They make up about approximately 67% of our patients, and and when you get to over 60, it's about 52% of our patients. So as the report talks about, just that the aging of the community is again going to lead to additional increase of calls for the fire department and our response. I may have skipped a slide, so I'm going to back up. Oh, I didn't. Okay. I thought there was one other chart. Oh, just in your report, there's another chart that also just does a comparison of the amount of EMS calls in the county versus the response in a comparison to what San Jose Fire Department's doing. So although the EMS responses in the county have increased slightly, our fire department calls in San Jose City have actually been increasing at a higher pace than them. So again, the good support is that the money from Measure T's back in 2018, getting us the new Station 37 and the soon coming Station 32 will help us to meet those demands from the community. So with that, if there are any questions, I'd be happy to answer.
Thank you, Deputy Chief. I appreciate the presentation. We'll go over to our members of the public first. And I'll give a reminder, this is on item D2, the fire department call volume status report. You can use the raise hand feature in Zoom or star 9. I don't see any hands. Okay, come back to members of the committee. Any questions from my committee members? Not seeing any here either. I'll just make one comment. I know it came up during our budget discussions from Councilmember Esparza in regards to trying to look at what we're doing with PD as well, which is just, the adequate level of staffing and funding to be able to respond to all of the needs within the community. Specifically, number one need, the calls for service, right, that are trending upward as we're seeing here. And I think that'll be an important look for our fire department as well. And I do know the chief has done some mapping out of growth where needed once we have the opportunity to do so, because the one challenge within the fire department is you can add some apparatus, but ultimately, if we're going to cover some of these areas, we likely need more stations, and that's not as easy as adding in patrol officers and sending them out in a car. Right? We need to locate the property and build a station, and so it's a bit more of an effort. But clearly, I think we're not going to see the volumes of calls dramatically decrease. I think it'll be like this trend where maybe at times we see it decrease a little bit with population, but I think we're going to continue to see that rise. And I do think that that medical call certainly is something that is not just an issue that the city or the fire department needs to be concerned with. We know a lot of those are individuals that are ending up in our county hospitals or issues with mental health, and a large number I know within that downtown core where I represent are individuals that are unhoused. And so certainly something that if we are able to grapple with better overall as a community and not just the city again, then I think we can help drive some of those numbers down too. Okay. Can I get a motion to accept the report?
So moved.
So moved. Second.
Okay, we have a motion and a second, and we'll do a roll call vote, please.
Arenas,
Yes.
Jones,
Aye.
Mahan,
Aye.
Jimenez,
Yes.
Peralez,
Yes.
Thank you.
Okay, thank you. Motion passes unanimously. That'll move us on to item D3, which is the Suicide Prevention Policy Annual Report.
Good afternoon, committee members and members of the public. My name is Sarah Sarate, Director of the Office of Administration, Policy, and Intergovernmental Relations. I'm joined today by Nora Chin, Assistant to the City Manager in API, to provide you with the Suicide Prevention Policy Annual Report. But I also want to highlight that implementation of this policy is supported by our City Manager's Communications Office and our Office of Employee Relations. This is our second annual report. Next slide. As you may recall, this item originally came through the council priority setting process advanced by Councilmember Perales, and the council adopted the final city council policy in March 2020. The policy seeks to advance awareness of suicide as a major issue in the city, and indeed a major national public health concern that impacts individuals, families, and communities. It seeks to increase knowledge of suicide risk factors and warning signs for suicide in order to, as the National Action Alliance for Suicide Prevention puts it, create a culture that no longer sees suicide as an unavoidable outcome, and to further improve risk identification, treatment, and prevention approaches. Lastly, it also promotes help seeking and awareness of resources to get people the help that they need. Before I provide a brief overview of actions taken by the city over the last reporting period, I will turn it over to Nora, who will provide a few key summary statistics from the county's latest annual report. And in alignment with your questions from last year, we do highlight race and ethnicity and other demographic factors. We provide this information in visual graphics, and I want to acknowledge that this is a sensitive and triggering subject, and these numbers represent real people and real experienced trauma by our residents and our neighbors. And with that, I will turn it over to Nora.
Good afternoon, committee members and members of the public. We're going to dive right into some data and some details. For the period between 2015 to 2019, the first and second charts show suicide counts and rates respectively. After a 3-year decline from 2014 to 2017, the county suicide count and rate increased to 148 deaths in 2018 and 169 deaths in 2019. The 2019 count and rate represent a 10-year high for the county. Initial 2020 data analysis indicates a count of 164 suicide deaths. This data shows that suicides in the county didn't increase during the first year of COVID. However, suicides already increased in the year prior. This also shows increases in suicides were noted among both females and males, although the rate increase was larger in females than in males. This is the second consecutive year in increases amongst females. In our next slide, when we analyze the information by age ranges, we can see that the count is actually highest in the age group of 25 to 64-year-olds, and the rates generally increase by age. Suicide rates increase in the age groups between 85 plus, 65 to 74, and 25 to 34. Between 2018 to 2019, we see the second consecutive year of decreases in suicide in the 15 to 24 age range. We also see the lowest rate among the 10 to 14 age group, but we can also see an increase of almost twice from 2018 to 2019. Some key details to note from these charts include the highest count was consistent amongst the white population, with the highest count among the 45 to 64 age group and a steady rate increase by age. The highest rate is consistent among the Pacific Islander population, though the 2019 rate decreased to its 2015 level. the Asian count and rate nearly doubled from 2018 to 2019. The Hispanic rate remained steady from 2018 to 2019. Of note, this is the second consecutive year of an increase in suicide rates among the Black and African American population. This map shows an analysis by suicide decedents, city of residence. The zip codes with the highest 2015 to 2019 aggregate counts are South County, South San Jose, Campbell, Milpitas, Mountain View, and Alum Rock. The cities with the highest 2019 rates are Campbell, Los Angeles, Los Altos, and Monte Sereno with 1 death. This next graphic shows us suicide rates per 100,000 and the suicide count by race and ethnicity. The suicide rate is higher among the white population, followed by the Black and African American population. It should be noted that the rate is more telling as it tells us the frequency of suicides amongst certain groups. This graphic also shows us hanging is the most common suicide method for the second consecutive year. Firearms are about half the percentage of the national suicides by firearm. The pandemic has had a dramatic impact on the focus group participants, taking a toll on their jobs, financial stability, social and family lives, and overall mental health. This really does open up a conversation about ways in which mental health can be addressed. But at a more detailed level, this graphic shows us that hanging is the most common among all race and ethnicities, except Black and white. Firearms usage increases by age. Hanging and jumping is higher among youth and increases with age. Drugging and poisoning increases and is higher than prior years. And finally, these graphs show us different demographic trends when using firearms or hanging as a method. This shows us an inverse relationship as they relate to each age group. Our partners at the Santa Clara County Public Health Department use data and key demographic information about suicide to target those most vulnerable and to educate the public. Between November 2021 to January 2022, the county started a new public awareness campaign for the safe storage of firearms among middle-aged men who are at risk for suicide by firearm in Santa Clara County. The city shared this information related to the campaign amongst staff and the public.
Thank you, Nora. I just want to make one small correction in regard to the cities with the highest 2019 rates. That was Campbell, Los Gatos, and Los Altos. So City Council Policy 45 requires the city to communicate around suicide prevention to various groups. We continue to advance all aspects of this policy that primarily requires ongoing communications shared with the mayor, the city council, current employees and retiree associations, and the general community. We have focused these efforts primarily around Mental Health Awareness Month, which is in May, and Suicide Prevention Month in September. These have included emails with useful information and facts, links to resources, and videos shared with us by our partners in the county. It has also included sharing campaign materials such as that highlighted by the Firearm Safe Storage campaign. The city manager's office continues to attend the county suicide prevention oversight committee, and we also shared the city's suicide prevention standard operating procedure for facilities with the city of Cupertino. As highlighted by Nora, firearms are the second most common method of suicide. The city council adopted a gun harm reduction ordinance in January, which, among other things, proposes to use fees paid by gun owners to invest in evidence-based initiatives to reduce gun harm. And this may include suicide prevention services or programs. The implementation framework for that ordinance is ongoing. Lastly, I will close by noting that we continue to be committed to implementing this council policy and supporting a public health framework for suicide prevention. You can expect additional communications in May and in September, as well as a future study session on gun violence prevention. Thank you very much for the opportunity to present, and we are happy to take any questions.
Thank you very much, Sarah and Nora. We'll go over to members of the public first. And first up, well, let me do the reminder. Sorry, we're on item D3, which is the Suicide Prevention Policy Annual Report. And you can use *9 to raise your hand or the raise hand feature. And you'll have 2 minutes. First up is Jenny Dang.
Hello, council members. My name is Jenny Dang, and I'm a student activist at De Anza College. And I'm here to urge the committee to approve item D3 on the Suicide Prevention Policy Annual Report. As a college student, especially during the past 2 years living in the pandemic, I know I can speak for almost every student that mental health has never been more important than it is recently. And it's not just students that deal with mental health on a daily basis, but rather mental health affects everyone of every age and community. And the suicide prevention policy would do so much for fighting against the stigma behind mental health, as well as provide those who need help with an outlet to get support. One of the big reasons why suicide rates are so high is the fact that most times people don't feel like they have anyone to turn to, and this policy would actively work to change that by increasing public awareness and educating every community on suicide prevention and intervention. And again, I would like to ask for your support on the suicide prevention policy, and thank you so much for your time and consideration.
Thank you. Next up will be Blair Beekman.
Hi, Blair Beekman here. That was a very nice public comment from the previous person. Thank you for that. Yeah, I mean, I'm just trying to learn important lessons, you know, about good mental health. And I hope we're learning how to talk about our issues more in, you know, therapeutic terms, counseling service terms, mental health terms. It helps people who feel alone. I mean, when we always feel alone, to have a place to turn to is important. And it's important. It's hard to learn how to do that. And it very much can address our jail system, our incarceration system, and our transition to leaving, I think, the jail system more. Yeah, I mean, I've had my best friend, he's died at a young age. He fell off a building, off a roof. And it's been really hard for me. My life has quite never been the same since then, and it hurts. But I've learned important lessons of a love life philosophy, and that peace and the warmth of life can really, really address our issues really well. And it's hard lessons to learn, but if that can help in any way towards people not wanting to commit suicide and wanting to go on and seeing that there can be a warmth to things, it's an important goal to try to work towards and understand, and that's a better future for all of us. So it's been quite a life. Life is quite an experience. So thanks for this item, and good luck to the practices of living life and not ending it and killing it. Thank you.
Thank you, Blair. And that'll be our final public speaker. So come back to members of the committee. Don't see any hands. Okay, Councilmember Arenas.
Thank you, Chair. I know that this report, I appreciate the report. I know it's something that we need to continue to keep track of. And I appreciate the awareness that is created just by keeping track of it to see where our population is. I noticed there is a lot of county specific information, and And although I think that the most of the impact that I saw that was San Jose related was more for older adults. And so I wanted to ask about what has been the trend for our youth, especially in some of the zip codes that we all know that have a lot of issues like poverty and crime and all those just difficulties. Is there anything specific for our youth in those areas?
Thank you for the question, Council Member. I would absolutely be happy to follow up with the county, the suicide prevention manager on that question. I would hate to give you incorrect or incomplete response, but we work closely with Mago, who is the prevention manager, and that's something that I'm sure she'd be happy to provide us more information on. I will note that because some of the underlying numbers for any given year can be small. That's one of the reasons why they aggregate the numbers so that they can protect the identity of individuals and their families. But I'd be happy to follow up on that for you.
Sure, I really appreciate that. And if it works by school district, let us know by school district, whatever is, I'm sure that we're going to give you something that doesn't flag the identity of anybody in particular. But I would be interested in that, especially as we're getting closer to our budget and drawing conclusions about where to have some investments or collaborations. I know that our school districts are establishing wellness centers, and I think it would be a really great opportunity for us to create a partnership or collaboration with those wellness centers with whatever age ranges that are impacted. And those are my comments. Thank you. Oh, and a motion to approve.
One last thing to note based on your comments, council members, that the county's suicide prevention program does have a Schools for Suicide Prevention partnership. And they have, the Alum Rock Union was part of that partnership in their pilot year, 2018 to 2019. And it looks like some of the new districts that have been added over the last 2 years include Eastside High School Union and Escuela Popular Charter. Also Evergreen Elementary and Berryessa Union. So we'd be happy to follow up and get some information on those too.
Thank you.
Thank you. We did have a motion.
Second.
All right, we got a second. Thank you. Yeah, no, first I want to say thank you as well for bringing this report back. Already accomplishing one of the goals that I had in mind, which was simply to have this discussion, right? To be able to continue to remove the stigma around suicide, talk about it, not be scared to talk about it, and ensure that we are talking about it with, number one, our own workforce, right? Our city employees, and ensure that we have the resources necessary, but then also that way we're setting an example and ensuring that our community does too. And then as we look at the data year over year, similar to the discussion we just had on the last item with sexual assaults, where we can see, are there trends, are there things that stand out, is there something that we should be focused on? And again, not necessarily meaning that the city is going to resolve it, but we can help, right, and ensure that our partners out in the community have the resources they need, that there is a focus. And a lot of this does overlap, right? I think we see that the trend a lot of times when you look at some of the census tracts, right, in the areas of where we see so many of these things occurring, and that overlap occurs a lot. And other times it doesn't. There's other things that stand out when we look at things like suicide, and that has been a very common trend where you have older white males, for instance, right, that have a high trend of committing suicide, and a lot of them, that use of that firearm goes up, right, as you get to the older demographic. And so I just think that it's very helpful to now have this as an annual report. I think we set a great example here in the Bay Area when we adopted our policy. It did take a couple years, but I appreciate my colleagues and their support on that. I have a lot of intimate experiences dating back to being a 13-year-old and one of my classmates committed suicide. He hung himself. And that was my first experience with it. And we were very confused as kids, and everybody actually wanted to believe that it was an accident, right? That somehow that must have happened accidentally. Why would Jonathan Mercer was his name? Why would Jonathan want to do that, right? It just didn't make sense. And then throughout the course of my careers, especially as I joined the police department, and learning about how there are more officers every year that will lose their life at the hand of their own gun through suicide than there are officers that are killed in the line of duty by suspects. And so that was alarming to me as well to learn when I joined the police department. And there was a resource that the police department provided, and it was a side note flyer that was put up, and they provided, actually the police department purchased books. It's called The Emotional Survival for Law Enforcement, and they did have free copies of the books, but it was kind of like a side note, and you had to really take it upon yourself if you took up an interest in wanting to pick it up and read it. I was always personally very interested in that, and as I learned some of the data and the facts around what are the actual threats that law enforcement officers run into, and when I learned that it's year over year that themselves in their own handguns, I really took that seriously, and I picked up that book my first year on, right out of field training, and it was completely eye-opening on the impacts that career can have on somebody. And I was surprised that there was really zero conversation about it in the 6-month academy, as we trained on everything and all these ways to protect ourselves and protect our community members. The emotional survival aspect was not a part of that, and it's not an ongoing required training either within the police department. I will say today, and this is a lot in response to some of this work we've been doing and prioritizing suicide prevention, that emotional survival book is being promoted better within the department right now. And we actually have, I know some of my own colleagues that unfortunately after now 15 years on the department are just picking up the book for the first time, and and promoting going to the workshops as well. And I know the department was promoting that recently as well. And I think we need to be doing more of that within our own department. And I know that I will not be surprised. I know we don't know the whereabouts, or the reasoning yet for our officer Dijon Packer, in San Jose State student, and Councilmember Esparza paid recognition as well on Tuesday, but I wouldn't be surprised. And I know it is surprising, right, to know that some people that again of such young age or for whatever reason, but again, it's something that is, if we can begin to remove the stigma and begin to ensure that people out in our community know that there are resources, and we can do our part, I think we can really drive these numbers down and help people. So thank you for the report. Appreciate it, and I look forward. Well, I don't know if I'll be here next year for the conversation on the annual report, but Councilmember Dennis.
As you were talking, Chair, I was thinking about the stigma of receiving counseling, not as a police officer, but just as a person, right? And the stigma of needing that support. I believe in counseling, and I've taken advantage of it. I have no shame in admitting that publicly, but not everybody can say that, right? And especially in our service areas like our police department and our fire department, there might be a stigma there, or also as part of your evaluations. And I don't know if there's any policies at this point. I know I've just heard it that, that if you go to counseling as a police officer, you may not be viewed as viable for promotions, or maybe for other just for opportunities. And I don't know whether that's true or not. I don't know if that's just, a misunderstanding, but I wanted to hear from you if this is maybe something that is a policy that we should be looking into as it applies to our police department.
Did you want to get a response from me?
Well, yeah, I wanted to get from you, Chair, as you were talking about, and I think you probably could speak to it the best. I'm not sure if
I
staff.
don't think we have anybody else from the PD on right now, but no, I can say it's definitely not a policy, and there's nothing that holds back any officer that is seeking out treatment. In fact, the department has great resources. I'm not ashamed. I utilized them, the city resources last year. And actually the police department counselors, after I lost my friend in the BTA shooting, and I never sought counseling ever in my life, and sought that out last summer, and continued through the beginning of this year. And it's a great, tremendous resource. And I do know that there are officers, unfortunately not enough, I think, but there are officers that take advantage of that when needed. And really, it doesn't hold them back at all. But unfortunately, I think that is part of the stigma. That's part of the belief that, hey, if I say that something is bothering me, right, or the job is bothering me, then maybe I shouldn't be doing this job, right? And so I don't want to say that. I don't want to seek out support. Our chief is here. He popped in. And so I think that there is a lot of that, and it's more a personal belief that holds a lot of our I know within the police department officers back from potentially wanting to seek out support. But Chief, I don't know if you caught the question or if you wanted Councilor Arenas to reiterate, but thank you for jumping back on.
No problem. I think I got the question, and yes, we have a crisis management unit which comprises of 2 officers. I recently increased that to 3 officers. In fact, they're at a International Association of Chiefs of Police health and wellness training right now. And that's something that's very important to me. That's a priority of mine, the health and wellness of our officers, not only physically, mentally, and financially, and overall wellness for our officers. So as Councilman Perales mentioned, it's been this program has been around for a long time. We provide peer support. We have a number of officers that are part of the peer support group, in addition to the crisis management unit of 3 officers. And we do provide training, not only on emotional survival, as Councilman Jazz mentioned. We just finished wrapping that up with that book with Dr. Gilmartin. But we're also going to roll out other trainings, such as substance abuse, suicide prevention. That's something that we've also provide. And right now we're actually trying to look at a wellness app for our folks that can help out with family support, counseling, meditation, and other things that I think will help in the overall wellness. But it is important. That's something that is a priority to me, and we're going to continue expanding and finding ways to provide overall wellness to our workforce.
Thank you. And the other question was, there isn't any, and this is what Chair Perales said. I don't. There's no reason for me to doubt, especially because he's had direct experience with this. But it sounds like there is no. When you consider somebody for a higher level position, you don't have access to their counseling or anything like that.
No, that's all confidential. Our crisis management unit, again, if officers go and see those officers, or they seek help through EAP or others, right? Any other counseling, it's all confidential. That's something that doesn't come back to anyone.
You know what, I'm just at the peripheral of hearing and things, and maybe this is something that should also take, and I don't know whether this is true or not, it's just me who's misinformed, but I think it would be something that would maybe help support our police officers during a very traumatic time, especially as they're getting, there's a lot of really good officers that are just getting some bad reps because of folks across our nation, or even just bad apples within very specific organizations. And I know from my sibling and my friends that it takes a hit on your morale, right? Being viewed as the bad guy. You're the bad guy, but you're there to serve and protect and risk your life 8 hours or 10 hours a day. But that could be very demoralizing. And so I'm glad that you're providing some additional support. It would be great for us to continue to elevate suicide prevention, but not just suicide prevention, but that support that, let's not get it to the point where we're just focusing on suicide prevention, but just health and wellness, as you are. And so I really appreciate that. Love to hear more about it as we move through some of the reporting. I don't know where it would be most appropriate, but just hearing about that health and wellness of our police department would be great.
Yeah, I know that we actually, it's not necessarily like a, crime trend report, but we can ask our police department to report back, right, as through this committee time to time. So I think if you'd like to see that, maybe then we could discuss that too offline, and that could be something that we ask our chief to come back and report on the overall health and wellness strategies, right, and goals within the department. I think that's a great thing. It certainly, and it's not just the police department, as we know, certainly the fire department, I know, experiences it as well, where there is a sort of a macho attitude, or a tough person attitude of, hey, I don't want to ask for help, or I don't want to make it seem like I'm not cut out for the job, or that it's it's weighing on me too much, whatever it may be, right? That it's reality, it exists, and it's unfortunate because I think right, that's not the case. It's not true. These are very, very difficult jobs that are going to be tough on anybody and everybody. It's been a stigma, and it hasn't been dealt with, I think, in the appropriate ways over the years in past. It's I think a lot better now. There's more resources and help, but we still have to overcome that stigma. And it's, whether it's suicide prevention, or it's just the stigma of asking for help, or receiving help, or stuff like the chief was talking about, meditation, where that may be something laughed upon, right? In particular conversations and groups where, I don't need, meditation is for hippies or something. And I say this out of experience, right, of people claiming that, and it's not, right? It's an extremely powerful tool for your overall health and wellness. And anybody that's done it, and I was able to experience it thoroughly through the ALF program, American Leadership Forum, and was wowed on how beneficial that could be for your life. So I appreciate all that, and I do think that may be something, Chief, that we'll ask you to come back in the future. Okay. With that, I do think if you can remind me, we do have a motion, correct?
Yes.
Okay, we'll do a roll call vote then.
Arenas?
Yes.
Jones?
Aye.
Mahan?
Aye.
Jimenez?
Yes.
Peralez?
Yes.
Thank you.
Thank you. All right, that passes unanimously. We'll move on to our final action item, which is item D4, the Digital Privacy Program Status Report.
Thank you, Chair Peralez. Hello, everyone. Committee staff, members of the public. Thank you so much for taking the time. We've had a lot of incredibly important and essential topics today, and I really appreciate you also making time to talk about digital privacy throughout all of this. I think Sarah Zarate put it really well that, we have data, we're collecting data, and we're using it, but behind each data point is a person, a human, a story. And when we think about protecting one's digital privacy or data privacy, the terms in many ways can be interchangeable. I want to walk you through, in a sense, how we've been really approaching over the past 6 or 7 months digital data privacy. My name is Albert Gahami. I'm our digital privacy officer under the Information and Technology Department, and I'm accompanied by the police department, who is also available to answer questions because they have been an incredible resource and we've been working together basically since I got here on ensuring privacy throughout what we do. So I'll dive in just with a bit of a history lesson. Over the last 5 years, we've really evolved in our digital privacy at the city. We've gone from our first security and privacy framework all the way to really establishing a program dedicated to digital privacy in 2021. And all the steps through this required an incredible amount of effort and teamwork across many departments, both inside the city and stakeholders outside the city, from our Privacy Advisory Task Force, our Digital Privacy Working Group, Harvard helping us with some research, of course, community engagement, to get to the point where we are today with a codified digital privacy policy and a digital privacy program. One other thing that I want to highlight that happened over these last 5 years was the number of connected devices has tripled or increased by 200%. And when I say connected devices, you can think of, Internet of Things, surveillance technology, think of cameras, sensors, things like that. And really, I bring this up to point out that, the technology is growing and it presents a fantastic opportunity to provide better, faster, and in my opinion, more equitable services, because we can identify where the needs are throughout the city and service them as needed. But with that data, it comes a responsibility in making sure that it's used in an equitable fashion. And the way I think about this is that privacy is really working towards the next generation of equity. When we think about 5, 10, 20 years down the line, the models, the cameras, the types of technology that we implement today, are we going to look back at them and think that they improved our communities, or they were the next iteration of some type of harming of equity or harming of communities? And so the way we really try to tackle this, privacy, advancing equity, is through purpose of the technology, defining the placement of the technology, and the performance of the technology. And I'll walk through each of these to give you a sense here. When we think about the purpose of the technology, and especially with data usage, historically data has been used accurately, but for a purpose that has harmed a community. One of the biggest ones that comes to mind is redlining. Redlining, the data was accurate, but it was used in a way that fundamentally segregated and harmed our communities. And I really bring this up as the first component of our privacy approach, because when we review privacy, when we review projects on behalf of privacy, the first question we're always asking is, how is the data going to be used? If it's going to be used for a purpose that supports the community, or if it's going to be, if it runs the risk of things, whether it be selling data or potentially in a way that's harming the equity of the community. This is the first and foremost filter, if you will, that we look through. The second one is around placement. And this one I want to take a moment on, because it's around the idea that if you choose to place your surveillance technology or any kind of technology in particular places in a community or in a city, you're going to get more information on those areas than you will others. And if you think about this from, say, an example of traffic enforcement, if I place traffic enforcement cameras at 3 particular areas in a city, I'm naturally going to see and catch more traffic crimes there than I will elsewhere, because I have a camera or a device that can monitor that place 24/7. And in theory, anytime a crime or a traffic crime happens there, I can immediately catch it. And that's not to say that this type of surveillance is inherently bad, but it's something that we need to be incredibly mindful of when we're thinking about this, that by placing technology somewhere, we can increase the catch rate. And we need to be able to monitor and evaluate where the city is collecting this data to understand if it's being inequitably distributed throughout the city. And honestly, on the flip side, collecting data to provide, say, beneficial services, whether it be parks or education after school programs, where we choose to collect data are the places where we'll be able to show a positive impact. And so it's feeding into the vicious cycle that the data informs the decision, which then informs the data itself. And then the third aspect is around performance, or you can think of it as accuracy. especially as we get into newer technologies that use things like AI or machine learning algorithms, they often can be black boxes and inherently be biased. This is just one study, but there's a number of studies that show that there are inequitable distribution of how good AI is depending on the particular individual. This example is around gender identification, but many other types of facial recognition fall into the same trap, that you have a very low error rate for lighter skinned individuals and a much higher error rate for darker skinned individuals, and especially for darker skinned women. And the fact is that when we're looking at this type of inequitable accuracy rates, there's fundamentally going to be an issue here if we're not taking steps, human steps, to check this type of technology. So I bring up all three of those to really highlight the perspectives that we as the privacy program are taking to ensure better equity as we go through these new types of technologies that the city might potentially explore using. And that brings us ultimately to the mission of digital privacy in the city, that the data that we collect on a community is used to support that community. We work so that our residents understand what is being collected, why, and how to engage for a safer, smarter, and more equitable city. Now, this mission is just simply a build off of the digital privacy policy that was established in 2020, which is in itself a build off of many of the great work that we've seen throughout the city on privacy. But I do want to highlight just some of the initial impacts that the program has had since initiating in October 2021, really around integrating itself into the functions of the departments, with over 13 departments and offices advised in how to integrate privacy into the very design of a lot of their projects. And this is a huge shout out to the departments that have been incredibly proactive and working with me and the digital privacy program to ensure people like the Parks and Rec Department, Department of Transportation, of course, police, and many others have been a great help in this. In addition to really integrating into design, making sure that our technology procurements, any type of technology procurements nowadays, go through some aspect of a privacy review. As of now, we've reviewed over 60 projects, and I anticipate that number to continue to increase. And while still a small amount of engagement, I do want to highlight that we have begun the engagement process just as the program itself with the community through public hearings, through community meetings, and through online avenues. I want to give a major thanks to the Mayor's Gang Prevention Task Force, especially, who has been a great avenue for us to provide notice and gather some feedback. And really, the last thing that I want to talk through here is just really ground this in an example that is fairly high priority, especially and pretty salient in the city right now. And that's around automated license plate readers, or ALPR, usage in the city. For those that don't know, ALPR is usually a camera of sorts that is mounted on, say, a police patrol car, like you see in this picture, or potentially on a light post, and has the ability to take a picture, identify a license plate, and then often will check if that license plate is on some form of wanted list, whether it be for a violent crime. There's been a lot of conversation in the city around for smash and grabs, for vehicle theft, really just checking through that list. This has really become salient recently with the increased push for expansion of ALPR by council, both in September as we passed the Vision Zero Monterey and Kirtner traffic safety project, and the additional $250,000 of American Rescue Plan funding that was approved in November, specifically for the expansion of ALPR. And it's because of these two that we've really been asked by council to revisit ALPR's usage policies. Currently, police already has an ALPR usage protocol, I should say, that they've been using for many years now. But due to the recent push for expansion, and since the digital privacy policy was established after the fact, council has asked that we revisit it in Q1 of 2022, which we are doing here. This effort has been supported by a variety of stakeholders, especially from the Digital Privacy Advisory Task Force, which is our committee of external stakeholders from SJSU, ACLU, and YWCA, and many other places that provide great input on this. And of course, a lot of close work with our police department. And I want to give a major thanks to Assistant Chief Joseph, Deputy Chief Schroeder, Deputy Director Tarico, and Division Manager Karuba, who have been fantastic in working with me in setting up or drafting the ALPR revised usage. And they are also on the call at this time to answer questions towards the end. But I do want to make clear that this is about the process that we're going through and how we are ensuring equity in our approach to ALPR. The actual usage of ALPR, or the refined proposal for it, that is not yet public and will be pushed out once we're aligned on it and ready for public engagement at a later time. But what I do want to walk through is how we're approaching this from the purpose, placement, and performance approach. First and foremost, thinking about the purpose and the needs to consider when we're thinking about ALPR usage. Of course, thinking about state and local laws, making sure that we're complying with them, but then also thinking about city values and needs. One of the first things that comes to mind is the culture and overall approach that the city has in making sure that what we collect does not adversely impact someone's ability to live in the city, specifically thinking about immigration status or investigations around that. So making sure that this data can't be used to harm things like that. And then, of course, equity among our communities. Making sure, again, that the data that we're using and collecting is ultimately in support of the communities that it's collecting that data on. Second is around placement. Going back to the idea of traffic enforcement, if we're going to place cameras somewhere, ALPR cameras, we have a higher likelihood of catching something there, potentially. And because of that, we need to be mindful about where they are being placed. And if we're placing particular cameras in particular areas, we should be able to understand that there's a good reason behind that. And additionally, thinking about placement from the perspective of notice, providing signage and notice throughout the city as cameras are coming up to both notify that not only are we using ALPR, but also providing either a QR code or a link or some other information where they can, one, learn more about the usage and provide ongoing public feedback. This is a practice that is increasingly becoming popular with other cities, especially other cities in the area. And I think it's a great approach to ensuring public engagement throughout this type of technology. And then lastly, thinking about performance. Annual reporting metrics around the ALPR usage, its accuracy, and ultimately its effectiveness in its ultimate goal of preventing and reducing crime. So I'll stop there on the ALPR example, but in terms of next steps, just thinking about that, we are finishing up a draft of the proposed refined usage for ALPR, and we'll intend to bring that public and engage with the public to get some feedback, and then bring it back to committee for review. But even more broadly than ALPR, thinking about other types of data usage, really going through this process for other types of both surveillance technology, but also technology that uses data and can have a profound impact on someone's life. Third is really expanding the equity effort through both data and privacy. There has recently been a partnership with the Knight Foundation, who is helping support the building of an equity through data and privacy program that'll be working with the Office of Racial Equity, City Manager's Office, and basically throughout the department's library, PRNS, around things like digital equity, responsible data usage, and really translating a lot of the information that we're collecting into equity impact and measurable equity impacts. And then, of course, beyond surveillance, really thinking of privacy and how we're protecting people's information as a way to enable trickier pieces of data collection that we can both provide more comfort around that data being collected and used, and making sure we're using it in a way that ultimately supports the community. That's basically all I have here. There's no, no other kind of impact metrics or really reports at the moment, but I just wanted, given the fact that the program is relatively new in its current form, to present to you how we're really approaching projects throughout the city. So thank you.
Thank you very much, Albert. Appreciate that. And we'll go over to members of the community first. We are speaking on item D4, the Digital Privacy Program Status Report. And we'll have 2 minutes. First up will be Blair Beekman.
Hi, thank you, Blair Beekman. Thank you very much for this report. It's the first time I've heard the person speak on these items. Thank you. It sounds like there is a care for what the future of digital privacy is really about. It's not just the inventiveness of tech itself and its practices. It's a more encompassing concept of how do you invite the community to really actively be a part of the process. I mean, these are ideas that you're starting to learn better. And considering where we were 10 years ago, where we could not talk about technology at all in our community, we are talking about it now. We are trying to see what options can be, how community can be invited to the process. And that means the ideas of open public policies, the concepts of civil protections as first and foremost is how to talk about our technology, and really inviting the public to participate in open public policies and guidelines and responsible practices and ideas. Is the technology really needed for a community, or is it some special toy that is of city officials that they feel is wonderful and that they try to put on to the rest of us? You know, these are the kind of questions we really have to ask ourselves, and we can't be afraid of those questions. We need to be headed towards a future that this project obviously can do of a shared process, an honestly shared process of guidelines, organizational examples of democracy in action, community democracy in action. We have to be brave enough to take those steps to allow the public to be more part of the process. And that takes trust and patience. And I hope we're learning that. That's what I've talked about for 8 years now. We're on a long road together, and something amazing can develop from this. Good luck in these efforts. Open democracy and accountability. That's the future of public oversight and good practices. Thank you.
Thank you, Blair. That'll conclude our public speakers. We'll come back to members of the committee. Don't see any hands up. I'll just, okay, Vice Mayor Jones.
Yeah, thank you, Chair, and thank you for that presentation. Obviously, this has been a very intensive, ongoing process. I remember when we first, started. I don't even know how many years ago, but I'm glad to see where we are now. My question is, if we propose, say, a project, and I'll just be specific, say, license plate and readers and gun detection technology in one of the districts in my one of the neighborhoods in my district. Can you just quickly walk me through just the process from the proposal or the idea to going through the data privacy process? So I just want to just have a tangible understanding of how it works.
For sure, Vice Mayor Jones, happy to. Effectively, there are 7 steps. Forgive me, the process itself, I can get a little technical here, but the process, it fundamentally starts with a conversation between me and the digital privacy officer and the program owner. So in this case, if we think about ALPR, I was in conversations with Judy Tirico and Frank Karuba and Assistant Chief Joseph and Deputy Schroeder around, especially around things like the Monterey and Kirtner project, right? And around the potential increases in ALPR technology. And so it started with a conversation, and then based on that conversation, you really start to look at the risk assessment of it. And I want to highlight this step because a lot of projects tend to be, we want to make sure that all data initiatives and technology projects go through this review process now, but not too many of them are at the same level of risk as, as some of the projects that you listed. I've had things cross my desk that are like, we need to order a printer, right? And so for things like that, right, low risk, it's basically immediate approval, right? As long as I have the documentation, what's happening, it's very quick approval. For medium risk projects, you can think of things like, I've had across my desk some youth intervention services. They also collect a fair amount of data, and actually some of their projects tend to be even higher risk because of the sensitive information. But I say higher risk, not in the sense of, it's harming, but that it's, you're collecting sensitive data on a sensitive population. But for medium risk, you go through kind of an abbreviated review. It might take basically them logging what personal information they're collecting, how it's being used, what the retention policy is, what type of notice is being provided. I workshop back and forth with people on, okay, well, if you're collecting this data, let's just make sure that they know what's being collected, they know how it's being used, and where to, provide input if they have questions. And then you have things like, the ALPR and gunshot detection, which, gunshot detection, at least its pilot happened, unfortunately, before I was here, but, I'm sure the conversation will come up. With ALPR, thinking about, thank you, Rob, for pulling this up, is really going through a full privacy impact assessment, which is essentially, across the 7 elements of our digital privacy policy, notice, retention, accuracy, equity, does it fit the bill for what we're looking for? Provide recommendations on it, and then create a data usage protocol. And that data usage protocol effectively defines how the data can be used. And that gets to those elements of equity that I was talking about. Where can, thinking about placement, purpose, and performance, like monitoring it, and defining that. And then, especially for the highest risk projects, putting that in front of the public, both online and then having direct outreach, which again, major thanks to the Mayor's Gang Prevention Task Force, who has been a real help in this avenue. And then putting it in front of you all for council, especially for, things like ALPR that we have here for review and approval. And then that data usage protocol basically serves as the guiding document, if you will, that informs how we can use that information. And then based on that data usage protocol, we have some annual monitoring metrics to just make sure that everything's on track, basically. And, to concerns around, effectiveness, just, it's making sure that it's being used well and that it does its job. So thank you for listening to my long-winded process explanation.
No, that was exactly what I was looking for.
Perfect.
No, that was spot on. So my next question is actually tied to this.
Yes.
For the general public who do not have the benefit of these briefings and presentations and additional information, how is this being communicated? Or do we have materials or on our website? Or when I go out to my community, when we talk about these initiatives, how can we communicate that to just the regular citizens?
Yes. So thank you so much for asking that. First and foremost, I would recommend pointing them to sanjoseca.gov/digital privacy. And if I share screen just very briefly here, basically the point of this page on the website is to provide a list of some of the key projects that are currently in progress, currently in review, additionally ones that are, as you can see, open for comment, and then allowing people to provide input on them. So this base gives them a little bit to read, review, things like that. Now, one of the things that I will be honest about, Vice Mayor Jones, is public engagement has definitely been an area that we need to improve on in the digital privacy program. We have access through the COVID Recovery Task Force, the Mayor's Gang Prevention Task Force, online, and through the Digital Privacy Advisory Task Force. But a lot of that is still approaching, I don't want to say just privacy experts, but people that might be more educated in the field. And one of the things that I'm trying to look for, and I welcome any help on this, is how can we get some of this communication, whether it be a table at events, at community events, or, if I can help, speak at something, or just get more of that conversational input. That's, in a longer term format, that's really what we want to get to. And I don't have all the answers for that yet, so I welcome any support.
Definitely, thank you for that. One of my concerns is that, again, as we roll out these initiatives, that the community can be scared from either lack of information or even worse, misinformation.
Yes.
I just want to make sure that we're able to address it. And Rob, I see you have your hand raised.
Actually, Rob can't speak until he changes back his background to the Clovers.
You noticed that. So sorry about that. Rob Lloyd, Deputy City Manager. Vice Mayor, just 2 ads on top of what Albert has talked about. Some is outreach tools, and we're going to be exploring those. The other is tapping partners to make sure that if something is deployed in an area, that we use those partners and move with them into that conversational piece. The goal being we want increased numbers on the public outreach piece. So right now we've, for example, received 10 from the last one, all positive, but it's a small sample size. So those are the 2 things, and you're actually on our map. So if something's in a council district, reaching out to the council member for that district and saying, can we get your help in this one? And we work, for example, in Monterey-Kirtner with Councilmember Esparza to make sure we could get some of that outreach and get that feedback. As Albert said, though, we're going to continue to improve that, and we have some conversations with the police department even on how do we make sure that's reachable. A third item is when something is deployed, you saw in Albert's presentation a QR code. So if you're in that area and you're, for example, a pedestrian, you can actually click on it and it takes you directly to a page with linked information so that you can find out what that use is, what our policies are and our principles are, and provide feedback.
Thank you, Rob. And also thank you for giving me the year that we started this process, 2016. Wow. It's been a while, but thank you. That's it, Chair.
All right, thank you. Can we get a motion?
I'll make the motion to approve staff's report.
Second.
Thank you. There you go, Rob.
I apologize, Chair. Mine's a yes.
Oh, no, sorry. We haven't called the roll yet. Just
I'm sorry.
No
I
worries.
thought that's what we were doing. Sorry.
No worries. I actually see a hand that came up. I'm assuming it may be on this item. So if we can go over to Dr. Roxana Marachi. And then Dr. Marachi, this is on item D4, our digital privacy program status report.
Correct. Yes, thank you. So I just wanted to provide a comment on this. I introduce myself first. I'm a professor of education at San Jose State University. I do research on student data privacy and EdTech programs. I also have served with the NAACP locally and at the state level. I'm speaking today as a private citizen. Several years ago, I gave some very concerning critical questions to the council about the Smart Cities program, and they had invited me to serve on the Digital Privacy Advisory Task Force. I just wanted to say that we have not been informed about the ALPR rollout until after it had been approved by the City Council. It seemed to have been a rushed decision made in September. We have a lot of critical questions. The ACLU recently published a report about the company that's being contracted for these cameras at Monterey and Kirtner. It's a company called Flock, and they have just published a report about concerns around mass surveillance with this particular company. I have a set of resources I'd be glad to share later. But there are a number of critical questions that have been raised, and there has not been enough public engagement on this issue. Members of the ACLU and other members of our Digital Privacy Advisory Task Force asked very serious questions that were not covered in this report, and I think that it was misleading in the slide to indicate that the task force supports this effort, we're providing guidance around guardrails for the data use policy, but I think that there are some very serious questions that the council needs to consider, especially given recent and ongoing concerns about ALPR technology and the surveillance of our most vulnerable communities. I'll say that the bit.ly link that I've created is bit.ly/ALPR_SJ, all capitals, for anyone who would like to learn more. Thank you.
Thank you. And appreciate you serving on that task force as well. And I'll just forward that question or concern through to you, Albert, if you'd be best to answer. How come we didn't go to the task force before that policy came to the council, or did we?
So the short answer to this is at the time, and Rob might know a little bit better than this because I actually started after it was approved by council. But in short, it's the Privacy Advisory Task Force, in a sense, was a bit on hold before we brought back in the privacy program through the Digital Privacy Officer. But Rob, please correct me.
Yeah, two fact points on that one is when it was in front of council, there was a memo issued. And in the memo for Monterey and Kirtner, for example, it actually said to adhere to the city's principles and to do the outreach. But the initiative was like, this is important enough that council's direction was go forward and do this and use these tools well. But to make sure we did the circle, so it was not necessarily in the order that that we in the task force would recommend. It was a priority item, so that's there when we circled back. And then, as Albert alluded to, we were still building the program at that time, and so now we actually have more of that capacity, and we'll be able to work with council in the future when you have those questions. Before the memos, we have a name and a face that you now seen that you can engage with and make sure that we do that outreach in advance. And just to, on Roxana's point, the task force we have there to challenge us. We want you to ask us the hard questions, and we don't want to imply support. A lot of times, like the ACLU in the letter that's attached to this item in the agenda, has a very strong feeling that ALPR should never be used. And our philosophy is there is an appropriate use if you are responsible about that use and you have controls and protections in there. So there is going to be some difference of opinion in those things, but we do want them to honestly hammer at us so that we keep the engagement and the use as civically minded and responsible as possible. So that's just some of the history points.
Okay, I appreciate that. Yeah, and I know you mentioned, Albert, on the potential need for better, broader community engagement, so which would be beyond the task force, but it definitely sounds like the task force is a good initial resource, right,
Yes.
of experts for us to be engaging. I will say from personal experience, I have utilized an LPR. I was LPR certified and drove an LPR patrol car and saw the personal effectiveness of it. And just out of my own ability, and as officers have a lot of access to sensitive data and information, I strictly adhered to that and saw a tremendous value in being able to identify, for instance, stolen vehicles, or wanted vehicles, and it was a tremendous asset as I was using it on the police force. I had no interest, myself, in what else might I be utilizing the data for, but I recognize that if that data is there and accessible, or somebody else can, as we've seen, hack into your systems, and take it. I know there's all sorts of concerns, and I would agree with Rob's comments on there certainly is a value to this. And again, I've seen that value, experienced that value personally, but there also are threats, and concerns, and we need to be conscious of that and make sure that we're putting up the barriers and the safety measures that way our community can rest assured that we will be utilizing this for their benefit, and that we're not going to be having access or not allowing data to drive inappropriate or outcomes that we're not going to want, and a disproportionate, say, impacts on particular communities as well. And so I know it's very sensitive. So I do appreciate Dr. Roxana for chiming in today and just your participation as well in that task force. and look forward to the continued updates on this. And welcome, Albert. Pleasure to meet you, and you did a tremendous job presenting on the topic today.
Thank you, Chair.
All right, that will do it for our comments. If we can get a roll call vote, please.
Arenas, Jones,
Aye.
Mahan,
Aye.
Jimenez,
Yes.
Corrales.
Yes, and I
Thank
do
you.
think Councilmember Hernandez looks like she might have fallen off. So, all right. Okay, that'll bring us to, oh, sorry, the motion passes unanimously with all the members present. I'll take us to our final item of the day, which is open forum. And just as a reminder, this is an opportunity to speak on any items that were not on today's agenda. And you'll have 2 minutes. We'll go over to Blair Beekman.
Hi, Blair Beekman. Thanks for the meeting today. A BART train is about to go by pretty shortly. Sorry if you hear some noise. You know, just to conclude, like I've been trying to say for you know, the past few months now, the ideas of reimagine health and human services, racial equity, and openness and accountability with technology practices and data collection, I think they can do an awesome thing in how we're talking about the current state of law enforcement and technology questions at this time. It can very, very much help organize the process for ourselves. And in fact, you know, it gives us such good answers that I feel it's and such good reasoning that it can give us a way that we will not have to like fully rely on so much heavy law enforcement or tech, because we can see better answers in our better practices. So good luck how to develop those skills. I think that's what we're all asking ourselves at this time. You know, the openness and accountability ideas, I hit it pretty broad there on the last item. I'm sorry about that. This huge train is going by right now, sorry. So, you know, as, you know, I hit it a bit broad, but I meant it in really good terms that I think there is a future that we can prepare ourselves for that is pretty amazing in terms of we're redefining what exactly a republic can be, and it can be more in terms of a community process where the public and community is invited to the process. That's interesting. We have guidelines and practices to do that with technology and accountability measures. It can also help internationally. How do we talk about the future of democracy internationally? It can help countries like Russia, like Syria. It's really interesting work what this can accomplish. I hope we can all want to practice it in some form.
Thank you, Blair. All right, that'll conclude our public comment, and the meeting is adjourned. Thank you, and happy St. Paddy's Day.